Hello friends, welcome to my third video on the Covid vaccine. I'm Dr. Kaushal Chhatrapati and today I'm going to narrate to you my experience of getting the Covid vaccine. As we all know, in India, the Covid vaccination has started from 16th of January 2021 and in the phase 1, the healthcare workers are being given the Covid vaccine free of cost by the government of India. Now, as you know, I'm an interventional cardiologist and therefore I qualified to participate in the vaccination drive in the very first phase. So, my best designated vaccination center, according to my BMC ward, was BYL Nair Hospital. It's a very big municipal hospital in South Mumbai, and it's pretty near from where I practice and where I stay. So I decided to go there at around 3 o'clock in the afternoon on 20th of January 2021. When I approached the Nair hospital, there were directions guiding me to the vaccination center in the Nair hospital. As you know, Nair hospital is a very vast property. When I reached the vaccination center, there were a few medical interns sitting on the computer, and they typed my name to confirm that I was registered as a healthcare worker on the COVID app, which was produced by the government of India, and my name was definitely on the server. Once they confirmed that, I was directed to a center to collect my token for vaccination. There were medical students sitting there also, and after explaining to me the procedure for vaccination and the contraindications, making sure I did not have any contraindications for the vaccine, I was given a token number and I was told to proceed inside the main room where the vaccinations were taking place. In the main room where the vaccinations were taking place, they checked my PAN card, which was the document I submitted before I was registered for being as a healthcare worker for the COVID vaccination. Once they confirmed my PAN card and my identity, my mobile number was once again confirmed. After this, I was referred to the booth number 1 for taking my COVID vaccine. When I went to the booth, this booth was manned by 2 nurses, and both the nurses told me that this is the COVID vaccination and I'm getting the Covishield vaccine, which is of course the Oxford vaccine manufactured by Serum Institute of India in India. And I said, of course, I'll be willing to go ahead with it. They told me to roll up my sleeves and they gave me the injection in a very painless fashion in the deltoid muscle, which is like the upper part of my left arm. The vaccination process itself was pretty painless. After the vaccination was over, time was jotted down on the receipt which was given to me, the token number which was given to me, and I was told to wait outside in the holding area for another period of 30 minutes. This is very important because most of the acute AEFIs, that is adverse effects following immunization, occur in the first 30 minutes. So any serious side effect like anaphylaxis or low blood pressure or bronchospasm or any allergic reaction or any rash would manifest itself in the 30 minutes in 99% of the cases. So basically we were made to stay in the holding area for 30 minutes. After waiting for there, we could go home. For 30 minutes we could go home. The injection site was pretty painless, as much as I could not make out which was the hand on which vaccine was given. It was so painless. Around 15 to 20 minutes after receiving the vaccine, I felt a little lightheaded. It was nothing severe, but it was a peculiar feeling of being a little lightheaded. So nothing more than that. The vaccination process was pretty much harmless, otherwise. Also, after being given the vaccine, I was given 3 tablets of paracetamol, and I was instructed to take one immediately, one in the night, and one the next day morning. I was instructed I may be having some pain local at the local injection site and maybe some fever, but nothing other than that. After waiting for the mandatory 30 minutes, I went out of the vaccination center. As soon as I went out of the vaccination center, there was a message on my mobile that you have successfully been vaccinated with the COVID vaccine. This is the on such and such a date at such and such a time, and your next date for the second dose of the COVID vaccine is on 17th of February. Please, we will send you a reminder SMS on the 17th of February itself. But even if you don't get the reminder SMS for some reason, please ensure that you come there after 4 weeks to take your second dose of COVID vaccine. In all, it was a very, very professionally conducted exercise. All the staff were very courteous and very polite. They were explaining the instructions, the indications, the contraindications of the vaccine in utmost details. The medical interns and the students manning the booths were also extremely knowledgeable, and they were really telling people who could and who could not take the vaccine. Fantastic experience, fantastic experience. 2 days after this vaccination, I received a call from the Arogya Setu division of Ministry of Health and Family Welfare, and they asked me in detail how was my experience about the COVID vaccine, whether there were any glitches, whether I was explained the contraindications, and whether they monitored me for 30 minutes after receiving the vaccine. This was a vaccine which I always wanted to take, and I was glad to get this vaccine so early in India. We are privileged amongst the developing nations that our nation is one of the world leaders in vaccine manufacture, and I was one of the first million patients in India to get this vaccine. So whenever it is your turn to get the vaccine, please remember there is nothing to be afraid. After the vaccine, I had no fever to talk about. Second day, I was feeling a little iffish, but one crocin was all I took. After that, there was nothing. On the second day after the vaccine, after 48 hours, there was some heaviness in the hand in which I received the vaccine. Although this was disturbing, this was nothing which prompted me to, take a stronger medicine or another dose of crocin, nothing like that. It subsided and went on its own. Some amount of reaction like fever or heaviness in the hand is anticipated. And in fact, it is desirable that you have something like this because it means there is local inflammation and the vaccine is working. That means that antibodies are produced by your body, and if you have, God forbid, a COVID infection in the future, this will fight it again. I can't wait for 17th February to come so that I take my second jab of the COVID vaccine. After that, hopefully, I will be saved from at least the severe most forms of COVID. I wish you all the best. Please take the vaccine, and kudos to the government of India and Narendra Modi ji to conduct this exercise with such precision and such finesse. Jai Hind, goodbye, stay safe and take care. Thank you.